Welcome back to WSAV News 3 today at 11 as we begin to close out National Colorectal Cancer Awareness Month, a conversation about options available in our community. Board-certified family medicine physician Dr. Jamal Lawrence is the founder and CEO of Harvest Health MD. He joins us now with more. Thank you so much for being here today.
Thank you for having me.
So we're talking about colorectal cancer. When you look at the numbers, it's the second leading cause of cancer deaths in the United States combined for men and women, with an estimated 158,850 new cases and more than 55,000 deaths projected for this year.
Yeah.
That is unbelievable, and
Yeah.
not in a good way.
Absolutely, absolutely. And that's why it's really important to raise awareness around screening and the options available. A lot of the times people don't know that, new guidelines have changed. The age for colorectal cancer screening has also changed. It's actually lowered from initially 50 to 45. And so it's really important that we get the word out that you go and you get screening, particularly if you have a family history, if you have abnormal changes in your bowel habits, if you have significant weight loss and other things in that symptom complex that would be worrisome. And so we really want to get the word out that screening is important and that you should go get screened by your primary care or GI health professional.
And so that was one of the things that I wanted to talk about, is the reason for lowering the age to get screened. What is happening?
Yeah. So what's actually interesting is that we've seen a decrease in colorectal cases for the elderly population. So when you're looking at 60s to 70s, but we're actually seeing an uptick in the younger generation. And so there's a gap between that 45 to about 55 where people have not gotten screened. We're actually seeing a rise in cases there. And so that's why it's really important to advocate for screening and to make sure that people are aware that the age is lower, and it's more important because we are seeing a rise in cases there.
And so doctors believe this rise is caused by what? Is it the food that we're eating? Is it the lack of exercise? What?
That's a great question, and it's really multifactorial. So there are a bunch of things that are going to increase your risk of cancer: excessive alcohol use, tobacco, smoke, some things that you can't change like age and sex. Otherwise, additional things like family history, genetic mutations. It's always important to live a healthy lifestyle, so we're always going to advocate for a whole food, plant-based diet, for making sure that you get plenty of exercise, because these things can lower the risk of cancer in general.
Okay, and so I know that early detection is key, education is key. When we talk about symptoms, by the time you start having symptoms, it's progressed to a stage where...
That's a very good point. You're bringing up screening versus diagnostics.
Okay.
And so screening is when you have no symptoms at all.
Okay, great.
And that's why we start at a certain age, and it's a blanket statement for across society. When you start to have symptoms like these changes in bowel movements, blood in your stool, which is a really important one, the weight loss and fatigue that we mentioned, those are when you are symptomatic, and that time you need to go directly to a GI doctor and to get an evaluation via colonoscopy, which is typically the gold standard for what we want to do when we're looking at colorectal cancer screening.
Okay, so are there other options available as well?
Absolutely, and that's the part that I really want to harp on today. A lot of people think that you can only do a colonoscopy, and that oftentimes creates a barrier where people are apprehensive about it. They're concerned about cost. They don't have coverage for insurance, and it's an invasive procedure, and some people are not comfortable with that. And there are plenty of other options. Options typically go into a visual aspect, where it's colonoscopy, sigmoidoscopy, and a CT colonography. Those are a little bit more pricey, but the reason why it's a gold standard for colonoscopy is because if they see something, they can treat it right then. They can clip the polyp, they can send it to the lab, get it diagnosed, and give you a prescribed screening follow-up. There are other options, though, which are less invasive, and some people, it might be a good option for some people, and that's the stool-based tests.
Yeah.
These are typically often available in your primary care office, called the FIT testing, fecal immunochemical test, as well as a DNA FIT test, which is a little bit more pricey. But those things on a cash base, you can typically get a DNA FIT test for about $600 or so. You can typically get the FIT test, I know in my office, it's about $30 or so. And so people often think that if I don't have insurance, I can't get screening, and that just simply isn't true. There are cash ways to get screening. There's screening that can be done in the primary care office. And those stool tests are a little bit more frequent with the screening, And the one caveat, though, is that if they do come back positive, you need to go to get a colonoscopy because that's how you rule out cancer.
Yes.
But those options are well available for people who think, I don't want a colonoscopy, it's super invasive, or I can't afford it.
All right, Dr. Lawrence, thank you so much for joining us today. I do want to say congratulations because Harvest Health MD is 5 years old this year.
Absolutely.
Congratulations.
Thank you so much.
And also the fact that he will be here more often, the second Monday of every month. I think that's what we discussed.
I think that's what you tied me into.
That's what I tied him into. All right. Thank you so much for joining us.
Absolutely.
You can find more information to see this interview again anytime on our website by visiting wsav.com/community corner. Right now it's time for a look at our forecast. Alyssa, good morning.